Hospitals across the country, as we've been telling you, are reporting new cases of multi-system inflammatory syndrome in children. It's also known as MIS-C, M-I-S-C. The COVID-19 related illness was reported during the first wave of infections, and doctors, we have one with us now, expect to see another uptick of patients following the quickly spreading Delta variant that we're in right now. So joining us with more is Dr. Ryan Redman, ER Director at Children's Hospital. What do we call this? MIS-C for short?
MIS-C, it suffers from a very cumbersome name, but it is something that's important to be aware of.
It really is. So are you seeing patients with this at Children's?
We have started to see some, and we kind of anticipate that we're going to see more. We saw about 30 kids with the syndrome that were confirmed with the first wave, and since the numbers are just so much higher than they were with the Delta variant, if we see anything in a similar ratio, which of course we don't know yet, but we expect that it'll be pretty predominant.
So what exactly is this?
So it's a post-infectious syndrome. So it happens 4 to 6 weeks after you have your COVID infection, and sometimes those can be very mild infections. It's not correlated with how severe you are, sick originally.
Okay.
And it is characterized by high fever that's persistent, and the biggest issue is you can get a bunch of inflammation in small blood vessels that can affect your organs like your kidneys and your heart. So that's why it's really important to pay attention to.
Very serious stuff. What are the earliest signs that parents can look for?
So usually the biggest thing is kind of fever, a lot of GI symptoms of vomiting, diarrhea. It can start looking a lot like just a regular old stomach virus. And then also trouble breathing, and then mental status changes, so they're just not acting right.
Maybe get listless, or just their personality changes?
Personality changes, sleeping a lot more than usual. Headaches can be a part of it too. It's kind of a whole constellation of symptoms, but usually the hallmark of it is pretty persistent and pretty high fevers that last for several days.
And that's when you know it's time to go to the ER.
Exactly, because we do need to do some things to check, because again, there's so much overlap in symptoms with other viral infections. There are specific things we need to check regarding health of kidneys, health of the heart, health of the lungs, to make sure that we're not dealing with this, which needs pretty aggressive treatment.
What is the treatment?
So we do immunoglobulin treatment, which helps reduce the symptoms, and then it requires careful cardiac monitoring to make sure that you're not having any of those kind of bad sequelae from it.
Right. Before I let you go, you mentioned high fever, and I know some parents say, oh, it's 102, we're fine. What do you classify as high in a child?
Yeah, so certainly our fever threshold is 100.4. Anything over that is a fever. Certainly our higher fevers are kind of in that 102 and higher is what we think of.
That's what you need to watch out for.
Yeah.
All right, we hope everybody stays safe.
Absolutely.
All right, thank you, doctor. We appreciate it.